An international workshop on mental health took place on October the 2nd and the 3rd in Hanoi, ahead of the International Mental Health Day, which falls on October the 10th. The event was jointly organized by Vietnam Central Psychiatric Hospital No. 1 and other partners, including the Vietnam Veterans of America Foundation. Along with the workshop, the organizers also held a press conference to inform the media circle on the current situation of mental health care in Vietnam and recommendations for the coming years. Experts say around 15% of Vietnam's population are suffering from mental disorders. Popular mental problems include epilepsy, depression, and alcohol abuse. Globally, a report published by the World Health Organization in 2008 said more than 150 million people were diagnosed with depression, more than 125 million with alcohol abuse, and more than 40 million with epilepsy. The organization says mental illnesses are growing in developing countries like Vietnam. The situation is often blamed on difficult living conditions in many areas, rapid economic and social changes, conflicts, and natural disasters. Hello and welcome to Sharing Vietnam. Mental health has been receiving more and more attention in Vietnam along with the development of the country. And in our program today, we will have the pleasure to talk to Dr. Harry Minus, a mental health specialist from Melbourne University in Australia. He has spent 20 years cooperating with Vietnamese doctors to improve the mental health care system here in Vietnam. So, good afternoon, Dr. Minus. Thank you so much for joining us today. Dr. Minus, you have been attached to Vietnam for the past 2 decades. Could you share with us a little bit about your connection with Vietnam so far?
I was born in a period, grew up at a period when Vietnam was very much in the news, and so I was very aware of Vietnam. And from the first time that I came, it became clear to me that there were many things to like and to admire about Vietnam. So as opportunities came up again to do further work, I became more and more involved. I have formed very close professional relationships with many people in different institutions, and over time have formed a lot of personal contacts.
Could you give us some more details on your professional work with Vietnam over the past 20 years?
Well, I'll tell you a little bit about my professional work overall and how the work in Vietnam fits. I'm a psychiatrist by training, and in Australia a lot of my work is with immigrant and refugee communities because they have a lot of difficulty in getting access to services. In Vietnam, there are many people who live in remote communities or who are poor and can't afford services, who can't get access to high quality services. So the work that I've been doing over the past 20 years, it's very intermittent. It's not, I haven't lived for long periods in Vietnam, but it has focused on how can the Vietnamese mental health system be high quality, how can it better understand the needs of the population that it serves, and how can it provide the best quality of services to the Vietnamese population.
Well, Dr. Minus, mental health problems seem to have been rising in Vietnam in recent years. What are your explanations for this trend?
The first thing to say is that I'm not sure that they are rising. The kind of research that needs to be done to actually demonstrate that more people have mental health problems now than they did 5 or 10 years ago hasn't been done in Vietnam. So there can be an impression that there is an increase in the number of people with mental health problems. That impression can be created by a real increase, or it can be created by people being more ready to talk about mental health problems. It may be that mental health problems are rising, and the way to think about that is to think about what are the factors that are likely to increase risk of mental health problems. And in Vietnam, as in many other similar countries, there are many. One is that The economy is changing very quickly. There are big cultural changes. There are changes in family structures, for instance. You know, what might have been the older extended family that can provide support for people is really fragmenting quite quickly. There are many people who are leaving rural areas to move to the larger cities, and very often they move to the more difficult areas of those larger cities. So both the person who moves is under a lot of stress, and the people who are left behind in the village are under a lot of stress. There is, I think, a significant problem with alcohol in Vietnam and a significant problem with drugs.
During the conference, you made a very interesting point regarding the impacts of mental problems on the economy as a whole.
Yes.
So could you tell us a little bit more about the macro effects of mental health of the whole country?
Yes. We know that mental disorders are more common in late adolescence, young adults and middle age. These are the most productive years of life. So if you have 1 in 6 people who has some mental health problem, then that will have a direct impact on their productivity. That becomes a general economic issue. We know also that the onset of mental disorders is most common in late adolescence or early adulthood. Now, this is a period when children are completing their education. So if a mental health problem intervenes and limits their ability to get the best possible education, that's also a very important economic issue for the country.
According to the World Health Organization, Vietnamese authorities have made remarkable efforts in mental health care. Since 1999, the Vietnamese government has been implementing the National Target Program on mental health. The prioritized program is focused on building a community-based mental health care network across the country. So far, the program has covered all provinces and municipalities. Thanks to the program, people with schizophrenia and epilepsy in the country have received community care and medicinal support, while stigma has been reduced.
Chúng ta đã có những chương trình quốc gia, chương trình hợp tác với tổ chức y tế thế giới để tăng cường cái năng lực của các cái chuyên khoa các bệnh không lây nhiễm, trong đấy có chuyên khoa sức khỏe tâm thần. Đấy là một. Thứ hai là chúng ta cũng đã có chương trình quốc gia chăm sóc sức khỏe tâm thần cộng đồng, tức là ngoài cái việc chăm sóc ở cái bệnh viện thì chúng ta cố gắng chăm sóc sức khỏe về tâm thần tại cộng đồng.
However, like many other low and middle-income countries, the mental health system in Vietnam still faces numerous shortcomings. While people with schizophrenia and epilepsy in the country have received community care, other mental disorders have not been included in the program, especially depression. The system suffers from difficulties such as the incomplete network, the lack of human resources, medicines, equipment and funding.
Và đối với ngành chúng tôi là ngành lao động thương binh xã hội làm việc ở trong những cơ sở chăm sóc và phục hồi chức năng cho người tâm thần. Đội ngũ cán bộ này hết sức vất vả, làm cái công tác chăm sóc, làm công tác trợ giúp cho người bệnh tâm thần, mà hầu hết là người bệnh tâm thần phân liệt nặng, mãn tính, có hành vi gây nguy hiểm gia đình cộng đồng. Tuy nhiên thì cái chế độ và cái chính sách ưu đãi đối với đội ngũ này theo như chúng tôi đánh giá là còn đang thiếu hụt.
And Dr. Minus, how do you describe the progress of the awareness as well as treatment for mental health in Vietnam so far?
There is a substantially increased awareness in the community about mental health issues. So it's a better informed population about mental health issues, although there is still room for significant improvement in the kind of information that people have access to, the quality of that information, and the extent to which people in the community have a real understanding that can still be improved, but there has been a big improvement over the past couple of decades. I think the amount of attention that mental health receives from government has increased greatly. So now I think it would be unusual to find a senior government person in whatever area, not only in the health ministry, who would not understand that mental health is an important issue for Vietnam. So that's a very big change compared to 10 or 20 years ago.
Well, despite the progress, it is obvious that Vietnam still faces shortcomings in taking care of the mental health of the people. So could you talk a little bit more about the challenges of mental health care in Vietnam at the moment?
The protection of rights of people with mental illness is something which has become much more clearly understood. And that's so in Vietnam as it is in other countries. I think government is very clear, and there are constitutional requirements about protecting the rights of citizens. But how you apply those to people with mental disorders doesn't have a really clear legal basis. And then when there are disagreements between a person who's mentally ill or that person's family and doctors, for instance, there is no basis to resolve those disagreements. So there are lots of reasons why it makes things a lot clearer for everybody concerned.
Well, an important solution proposed by experts is to raise the participation of the media in mental health issues. So could you talk a little bit more about this solution?
Well, doctors and other professionals are not very good at communicating with the public, unfortunately. The media are, of course, excellent. That's their business. And I think what is required is not for the media somehow to be used to communicate, but for a partnership to develop between experts and the media, for a conversation to develop, so that the media are themselves very well informed, so that they are able to understand things as they come up, whether they are policy issues or whether it's an event in the community that has some kind of mental health implications. So that when they report, whether it's print or electronic media, increasingly the use of social media of various forms, when they report, they do so in a very informed way. I think it's also the media's responsibility to understand where there are problems, to investigate those issues, to report them fairly and accurately, and to also, when something comes up, to be able to say, about this issue, I know who is the best person I can talk to, so I will contact this expert or this member of government or a member of a community organisation, so that the whole story can be told about an issue. And I think that requires a kind of a continuing partnership.
Well, Dr. Minus, thank you so much for joining us today and sharing valuable information regarding mental health. Let me wish you good health in the future too, and further successful collaboration efforts. Well, that's all for our Sharing Vietnam today. Hopefully, with the active contribution of Dr. Minus and other international experts and the rising awareness among the public and the media circle in Vietnam, the local mental health system will be further improved to facilitate the sustainable development of the country. Thank you for watching and see you again next time.
Thank you.